Jai Hind. In continuation with our educational surgical videos of our Department of Pedontology and Implantology Subharti, today we'll be demonstrating to you a surgical procedure of depigmentation using laser versus electrosurgery. So when we talk about periodontal surgeries, we as a periodontal surgeon perform three types of periodontal surgeries: pocket reduction flap surgeries, mucogingival or plastic surgeries, and the third is placement of implants. So the first type of surgery, that is pocket reduction surgery, are done when a patient comes to us with a diseased mouth, that is having periodontitis. So we end up doing flap surgery for correction of that periodontitis with or without placement of bone grafts and or GTR membranes. The second type of surgery we'll be demonstrating today, and that is perioplastic surgery or mucogingival surgery. Now, this surgery basically means that the patient doesn't have any disease as such, but the patient wants to get the surgery done only and only from an aesthetic point of view. So this is the second surgery. The third is, of course, placement of implants. So, with regard to today's surgery, depigmentation, that is, a patient has come to us with black gums and we want those gums to be converted into pink gums. So, first and foremost, with regard to this procedure, you are supposed to remember that only and only depigmentation due to physiological reasons has to be corrected. If the patient has any systemic disease which is causing that increase in pigmentation, that is melanin pigmentation, correction of the underlying systemic disease has to be done rather than going in for a surgical modality of depigmentation. So now we have determined that the patient is having no disease as such in today's patient, and the pigmentation is because of physiological reasons. So now we are left with two main modalities by which we can do this procedure. The first is conventional method, that is using blade, and the second is thermal modalities, that is laser and electrosurgery. The differences between laser and electrosurgery will be demonstrating to you during the course of our demonstration. But as of now, please understand, both these modalities have their own set of advantages and disadvantages. Blade is faster, cheaper, but the problem is bleeding. You have a raw bleeding surface from which oozing occurs. These modalities are comparatively slower at times as compared to blade, but require less surgical dexterity. You can master them easily if you have proper knowledge about the armamentarium. And the main advantage is hemostasis. No bleeding is there. The entire surgical wound is covered by a char layer, so as such, no bleeding is there. But there is a disadvantage of it being much more expensive as compared to a blade. One final misconception which I need to clear before starting with our demonstration is that many a times people think that these modalities are comparatively painless. No LA is required, they say, for a laser or electrosurgery. This thinking is absolutely wrong. A cut is a cut, be it with a blade, laser, or electrosurgery. Proper anesthesia is a prerequisite. That is the first thing. Second thing, many a times people think that the amount of discomfort post surgery will be minimal with a laser or electrosurgery as compared with a blade. One thing which we have to understand is that if we are cutting something with a blade, the trauma, the injury is restricted to only those areas where that blade has passed. Suppose the same thing is being cut with a thermal modality. What that means is that when we are cutting this thing, it is cutting by burning the tissues, heating the tissues. Part of that heat would be dissipated into the surrounding tissues. This is known as collateral tissue damage. What that means is that the amount of inflammation, edema, would be much more in the case of thermal modalities as compared to a blade. So, with these basic points in mind, let us now proceed to our OT, where we will be starting with the demonstration of depigmentation, in which the left side will be operating with a diode laser and right side will be operating with electrosurgery. So, let us proceed to our OT now. Now we are starting with the demonstration. So as you can see, now we are giving topical anesthesia. So this is 15% lignocaine. Proper isolation is a must. Now we are injecting the local anesthesia. We are injecting 4% articaine. We are using 30 gauge syringe, a needle for injecting this anesthesia. And this cartridge syringe otherwise gives painless anesthesia. So as you can see, we are just going submucosal as such, and a bleb, an elevation is getting formed. So the basic objective is that the bleb should be formed, and we should then be injecting in the periphery of that bleb, so that the next injection wound, that needle wound or needle penetration, should be occurring in the area of infiltration only. So as you can see, obvious ballooning has occurred in the depth of the vestibule. So this obvious ballooning is important, then only the anesthesia effect is there till the tip of the papilla. So we have to give anesthesia like this throughout. Now we have started with depigmentation using laser. So as you can see, we are giving brush strokes. This is the laser which we are using. This is a 940 nanometer diode laser. The light which you are seeing, the green light, this is the incorporated helium neon laser of 655 nanometer. So this is just a guiding beam which is there in this laser. It doesn't have any cutting efficiency. So this gets activated the moment we switch on the laser. The actual laser is invisible. That gets activated only and only once we are pressing the foot pedal. So as you can see, overall we end up getting a bloodless field. That is the main advantage of using a laser. The charred layer which is there, that is the one which actually prevents the bleeding part. So this charred layer we don't have to scrub off, we don't have to rub it off much, otherwise oozing will start. And many a times we have a doubt whether this burnt tissue is actually remaining pigmentation or whether it is charred layer. The rule is simple, you apply the tip back in that area. If the blackishness increases, then it is charred layer. If it reduces, then it was pigmentation. So can you see? We are going almost till the first premolar. So first premolar, we include in the anterior teeth with regard to aesthetic surgery. So this is the procedure. Left quadrant we have operated with this laser, and can you see? This is the disadvantage. This is a flexible tip. Now right side we are starting with electrosurgery. So we are using a loop electrode here. We are operating it at 4 watt. So basically the power setting is set at 4. And can you see, overall the cutting efficiency of electrosurgery is faster than a laser. But the issue is, again, because the cutting efficiency is more smoke production would be there. And secondly, you have to be very careful when you are using electrosurgery as such, because the chances of it dipping into the tissues, you exposing bone, are more with electrosurgery as compared to a laser. So it has to be superficial brush strokes, but as you can see, the tip is rigid. So it is not flexible by like the laser. So had it been a case of crown lengthening, the way we had demonstrated in the last video of aesthetic crown lengthening, for that electrosurgical apparatus would have been better suited. So now the procedure is complete. Can you see? Bloodless field is there on both the sides. We hope our team of PERIO Subharti was able to demonstrate the procedure of depigmentation, that is, removal of the gingival epithelium till the basal layer where the melanocytes are produced, by the use of laser and electrosurgery. Whichever doubts which you have, you can ask in the comment section. The post-operative photographs of this case, that is 24 hours, 1 week, 1 month, 3 months and 6 months, we'll be posting on the Facebook page and the Instagram page of our department. So do follow our social media pages also. In this particular case, the surgical assistance was provided by Dr. Himanshi and the entire documentation was done by Dr. Manisha. Our next video would be on socket preservation, that is, how to atraumatically extract a tooth and then do bone grafting with primary closure in a case where immediate implant placement is not possible. So, do subscribe to our YouTube channel. Jai Hind.